You are coming in here not showing me any respect. I am the SHO, you are junior bloody houseman. I'm going till you can give me some respect.
Correct. On which side?
Hi.
Hi. Cubicle 2. Okay.
You fell and immediately felt something go in your back. Now your legs are completely dead. Do you feel this?
They're dead, man. Oh, give me.
Back in a few minutes.
Where the buffalo rolls.
Do you think he's faking?
Is the Pope Catholic?
You'll still need the RSO to see him if we're going to chuck him out. It was absolute crap with that Abdul clean earlier. Maybe it's only to be expected.
What? Of a packy, you mean? The amount of paracetamol you've taken requires treatment, so we're going to admit you to the ward. Okay?
Your legs, you've uncrossed them. I got you banged to rights, sunshine.
Actually, it was me who uncrossed his legs. I sort of felt sorry for him.
Oh, Shandor, I love your daughter.
Yes? Dr. Patel, it's Raj, the houseman. I have a patient in casualty who claims to have complete motor and sensory loss below the waist following a fall. I wondered if you'd mind seeing him, please. House officers aren't allowed to discharge patients from casualty. He needs to be seen by you, even if he is a malingerer. Why, thank you.
Do you actually like this job?
Being a doctor is the most miserable job on this earth.
But you must have wanted to be a doctor once, surely.
People keep pushing you. Pushing, pushing, pushing. Sorry. Once I might have been able to stand for something. Now I can only take pride in not falling for anything. I don't know what it means, but it sounds good.
This is a case of rheumatic fever. He's a medical patient, not surgical.
Isn't rheumatic fever something to do with the heart?
I am bloody in charge. You do as I say.
That's it. I'm calling Mr. Docherty. Let's see if we can get the hospital manager to check Patel's registration.
Alex Legg, hospital manager. I've checked with Dr. Patel's locum agency and re-examined her own photocopies. I can assure you her documents are authentic.
Good. Her documents? Patel's a bloke.
Then I suggest the police be informed this instant.
Well, this is all very embarrassing.
If you aren't willing to call the police, Mr. Legg, then I certainly am.
Rest assured, I'll call them at once. Good afternoon, Mr. Docherty.
Last year he was working the till in the canteen. Now they've put him in charge of the hospital.
I'm pleased that Dr. Patel has finally got his collar felt, but we're now shy on RSO, Mr. Docherty.
What happened to that layabout Slocum?
Dr. Slocum isn't a locum. His name just gets misprinted on the rota.
Then I shall be RSO.
I'm really sorry to trouble you, sir. The patient is an 83-year-old man with a past history of multi-infarct dementia. He's
Sounds medical to me. Prefer to RMO.
Yes, Mr. Docherty, thank you.
Anything else for me, sister, while I'm here?
I have a feeling there'll be very little today, Mr. Docherty.
Right. Just one thing. As I swap takes with Mr. Bettencourt, All surgical patients have to be admitted under me.
I'll make sure front desk know.
First rate. Bye.
Bye-bye.
That man's a supernova where a candle would do.
I never understood why it's the snorer who always gets off to sleep first. I'm Dr. Maitland.
I just wanted to know what the drip was for, please.
Poisonous byproducts of paracetamol are now accumulating in your system, damaging your liver and possibly your kidneys. The drip provides extra fuel for the liver to help it break down the paracetamol more safely.
What will happen if the treatment doesn't work?
We all go into liver failure and die of it.
I wonder if you'd mind taking out the drip, please.
I'm obliged to treat you.
Do you really care whether I live or die?
Yes, of course I do.
Really?
No, of course I don't.
So would you mind taking out the drip, please?
Look, face the fact that you might be making a mistake. And if your life really does mean so little to you, it's not very fair of you to ask me to jeopardize my career for you, now is it? Anyway, if it doesn't work, you'll die. If it does, you can always top yourself again. Hmm? Okay. Parvalex infusion to be continued, as on the chart.
Yeah, that sounded like a tricky one.
Only if you let ethics get in the way of doing what's right. Thanks. Oh yeah, Andrew's not feeling well. If there are any problems in the night, bleep me instead of him.
Okay.
Sarah, if you're not doing anything tomorrow night, I was just wondering...
No, Raj.
RSO speaking. May I have her name, please?
That's not Ernest Docherty, is it?
It is. My senior officer's off today. All hands on deck, so to speak.
Ernest, it's Gerald. Look, man, I couldn't possibly fit this heart sink patient onto tonight, oh dear.
Oh, we must have around some week, then.
Yes.
Goodbye.
Mr. Docherty, I'm afraid that no one seems to have gone round the wards to identify empty beds.
And whose responsibility is that?
Well, yours, the RSO's.
It is my job, whilst dealing with acutely ill patients, to trudge round this hospital in performance of some chore which could easily be accomplished by the electric telephone. If you will kindly organize the nurses in the surgical unit, I'm sure we can have this sorted out in a jiffy.
That's his job. Raj, there's no one trained on him. There's a couple of IVs to do.
Have you been trained in the administration of intravenous drugs, Dr. Raja?
No, Mr. Docherty.
It appears my house officer isn't qualified to give IV drugs either, sister. I suggest you enlist help elsewhere. Jolly curious about that locum today, wasn't it?
The thing that bugs me is that everyone assumed the reason he was incompetent was not because he was unqualified, but that he was an Asian.
Ah, the lesson is, in our profession, there is no room for racism.
I know. It's chock full already. What was I doing getting off with Nurse Whitecoat? More blokes have landed in her bed than hit the Normandy beaches on D-Day.
Birds like that for blokes who are too lazy to wank.
I feel like Mr. Spock in that Star Trek episode. 'Tis the pond far, the time of mating. If I don't get laid, I'll die of it.
What doesn't help is having a medical student who's a wet dream come true. Bagsy first to lick the seat.
It's not normally this quiet on take, is it?
It'd be a catastrophe if it was busy. I need someone to muck in, not use leeches the last time he took blood. Seminal wedge pressure is out of control, Jim.
Sorry.